What were some of the themes? Let's start with strategy. I mean, the financial performance, I think, is going to be an interesting conversation as well. But let's start with just high level themes. What we heard from some of these CEOs.
From a strategy perspective, and I think we come from this, you and I, from sort of a provider angle, given that was both of our backgrounds. But this industry is becoming as much about the for-profits and the IPOs and the private equity investors as it is the nonprofits. These worlds are really converging. So in terms of strategy, it was interesting. What I saw from the providers bill is in the past, we've talked a lot about insurers acquiring provider assets and kind of moving into that space and becoming payviders. And one of the macro themes that I saw really emphasized with all the nonprofit presentations was a convergence of the strategy. The providers are now kind of realizing where the competition is going to be, and they're expanding. They're acquiring assets away from just the kind of acute area, thinking of being upfront with the patient, the consumer. They're thinking about the whole continuum of care, whether that's home care, whether that's ancillary types of services, whether that's value-based care. So I think what I saw was a real emphasis this year was a realization on the provider's part that they can't survive just being fee-for-service, acute care kind of hub business. They need to actually expand their offerings and get ready for the future. So I think that's the battlefield has been set, and it's across all these areas of care.